Hello everyone, welcome to my poster presentation for the Spore Summer Institute 2020. My name is Jamie Boisvenue. I'm doing my PhD in the School of Public Health, but today I'm going to be presenting my master's thesis research on developing a case definition and identifying metabolic syndrome in young adults in Northern Alberta. We know that metabolic syndrome is a clustering of risk factors that eventually leads to the development of chronic disease. We know that the prevalence and increase in metabolic syndrome is parallel to that of other chronic diseases in Canada, and that physicians are constantly faced with challenges in being able to adequately assess and identify metabolic syndrome in individuals given a large variation in clinical definitions, etc. So we set out to identify metabolic syndrome through a case definition and algorithm. And we used data from the Northern Alberta Primary Care Research Network, part of CIPSIN, to conduct a cross-sectional observational study that looked at a specific case definition that was developed and harmonized through various cut points from the World Health Organization and NCEP ATB2 criteria, Diabetes Canada, etc. What we found in our cohort was that after filtering for missing sex, postal code, duplicates, outliers, etc., we started with a denominator of 15,766 individuals. And our case-finding algorithm takes a combination of 10 different combinations of three factors, and if an individual is identified as having all three factors, they go into a metabolic syndrome case list and are identified as having metabolic syndrome. The caveat here is that individuals can be identified more than once if they have more than one combination, so we factored that into our overall population prevalence estimates. What we found was that men overall have a higher proportion of elevated blood pressure and hypertriglyceridemia compared to women. And among those with metabolic syndrome, women have a higher prevalence of diabetes and men had a higher prevalence of hypertension when we looked at chronic disease. When we looked at missing data, what we found was that fasting blood glucose was the most prevalent risk factor for missing data amongst both men and women with metabolic syndrome, and that women had overall a higher proportion of missing data compared to men. The strengths of this study include a large-scale epidemiological investigation into the prevalence of metabolic syndrome using primary care EMR data. We also had validated CIPSIN disease diagnosis definitions, which allowed for a better estimation of prevalence of METs. But also there's some limits to generalizability, given that this is an enriched sample population, and also that we can't really infer clinical significance given the high proportions of missing data. So to conclude, the prevalence was 4.4%, not really much of a difference between men and women, but the high proportion of missing data leaves some cause for concern. So once again, thank you for the opportunity to present, and I hope that you enjoyed the poster.